Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Today I wanted to talk to everybody about dry needling and how it should be thought of as a brain treatment rather than a specific musculoskeletal treatment. I'm not saying that we're not treating the musculoskeletal system, but what I'm saying is that the only way that we are inducing these types of positive changes in such a fast period of time, the only possible way that this is able to occur is through rapidly and significantly improving brain health and homeostasis, right? So we know based off of our best objective studies that the overall result of dry needling on the brain and the body is parasympathetic dominance compared to baseline. That just so happens to work out perfectly for us because if the overall result of dry needling was sympathetic elevation compared to baseline, nobody would want to get dry needling done because people are already suffering from a hyperactive sympathetic autonomic nervous system, right? So remember, the sympathetic autonomic nervous system and the parasympathetic autonomic nervous system need to be in harmony. It's like a seesaw that's balancing back and forth, right? One end shouldn't really get stuck too high, and it should be balancing back and forth. So if the sympathetics go up, the parasympathetics get reciprocally inhibited and vice versa, right? It just so happens that the typical human response to mental or physical stress, strain, pain, or trauma is to elevate the sympathetic autonomic nervous system. 75% of the United States population is either overweight or obese. That makes guaranteed 75% of the United States population is living with chronic sympathetic hyperactivity. A huge percentage of the United States has some type of autoimmune disease. That's almost 100% of the time at baseline, on a base level, due to sympathetic autonomic nervous system hyperactivity. If the sympathetic autonomic nervous system goes over your individual threshold for self-regulation, once you get above that sympathetic threshold, your autonomic nervous system loses the ability to self-regulate and it can't find its way back home to homeostasis. What amazes me with dry needling is that it leads to such amazingly positive results, and the only thing that we're doing is poking needles into people's body. It would make a little bit more sense to me if you were seeing these amazing results after a little bit more of a prolonged time period where people may start to eat better, they may start to exercise, and then if you add that stuff into dry needling, it seems to me like that's what should be necessary to make such massive and dramatic positive improvements. But a huge percentage of the time, people with decades-long injuries or impairments completely recover with thoughtfully implemented dry needling combined with joint manipulation because it's enough of a powerful stimulus to drop the nervous system, the autonomic nervous system, back down into its regulatory stage, or it's back down into the state where it can self-regulate. If the autonomic nervous system can't self-regulate because the sympathetics are too high, which are inhibiting the parasympathetics, and we have this big discrepancy between sympathetic activity and parasympathetic activity, the vagus nerve gets shut down, the brain communication between all of our organs gets shut down, our immune function goes down, our ability to recovery from injury goes down, everything gets fouled up. In my opinion, the biggest underlying cause of disease and impairment in the United States, and this holds true for autoimmune diseases, idiopathic diseases, chronic diseases, impairments, whatever, is sympathetic autonomic nervous system hyperactivity. Now, this happens for a handful of very, very common reasons. The most common reasons would be poor diet, right? Eating any processed food is like putting actual poison into your body. So any extra substance that you place into your body that your body either can't break down, like folic acid, where folic acid is put into 100% of all non-organic grains in the United States. The United States is the only country on the planet that allows this to happen. And the reason that other countries don't allow this to happen is because about 50% of the population cannot break down folic acid into methylfolate. That's just one simple example. So for people that have the MTHFR gene mutation and can't break down folic acid, every time you eat a piece of bread or cereal or anything with folic acid in it, it's like putting water into your gas tank. The gas tank's made to burn gas. It's not made to burn water. So if you start adding little bits of water into the gas tank, at some point, because the engine can't process water, the water accumulates to the point where our body keeps trying to break it down, it can't, and it clogs up the system, and then everything else dysfunctions from there. So eating processed food is a major avenue to sympathetic autonomic nervous system hyperactivity. A lack of exercise is another one. Again, 75% of Americans are either overweight or obese, right? Indicating that they really don't exercise. We know for a fact that at least 50% of the United States doesn't exercise at all. And we know based off of home exercise program studies and physical therapy that basically no patients continue with their home exercise program once they're done with physical therapy. So all else being equal, it amazes me that dry needling can achieve such fantastic changes in people. And the reason that that is possible is because it's a direct brain stimulation, or it's a brain treatment, right? With dry needling, we're just utilizing the soft tissues throughout the body as a means of access, or as access points into the brain, right? So if you asked a neurosurgeon to look at a brain MRI of a stroke patient that they had not yet met, they could probably give you a relatively good guess as far as what types of symptoms that patient was going to have based off of the brain areas that were disturbed. The same exact thing holds true in reverse. All nerves are two-way highways, right? So there's an afferent and an efferent part. The vagus nerve is the nerve with the most efferent-afferent discrepancy, where about 80% of the vagus nerve fibers are afferent, right? So about 80% of the vagus nerve's job is to tell the brain what's going on with the organs, so the brain can then return the proper signals to regulate the organs correctly. If the vagus nerve gets inhibited, which the vagus nerve is the most inhibited structure from chronic sympathetic hyperactivity because it's the most parasympathetic dominant structure in the body, a couple of new meta-analyses have guesstimated that about 75% of all parasympathetic fibers in the human body and brain are in the vagus nerve itself. If the vagus nerve gets inhibited and the brain starts receiving faulty information about what's going on with the organs, it's impossible for the brain to then to regulate with the proper signals, because it's not receiving the proper input. If you don't receive the proper input, it's basically impossible to achieve the proper output. So there's a couple of new studies that have really exemplified this. And again, this has been known for a long time, but with newer technology and better imaging, we've been able to see specifically really significant improvements in brain health, both immediately upon needling and long-term afterwards. So this one newer study was looking primarily at the cranial suture lines and cranial head and face needling and what was going on in the brain. So this holds true for every needle placed in the body. In some location of the brain, placing a needle in the soft tissue is going to cause improved blood perfusion. It's going to cause improved neuronal response. Basically, people with brain abnormalities, either strokes, concussions, any type of brain problems, two of the primary underlying factors that are inhibiting that part of the brain from working properly are hyperexcitable or hypoexcitable neuronal activity and decreased blood perfusion. Some neurons get hyperexcitable, some neurons get hypoexcitable. It really just kind of depends on what side of the autonomic nervous system those neurons are more generally associated with. Ones that are sympathetically dominant are going to be hyperexcitable. Ones that are parasympathetic dominant are going to be hypoexcitable, and there's going to be a widespread decrease in blood perfusion in the brain. Based off of both Doppler studies, fMRI, CAT scans, and other imaging, we can see in real time that two of the most objective factors about dry needling as far as the brain goes is that it improves neuronal activity and it improves blood perfusion. So again, this should stimulate a whole bunch of different thoughts. This is the same exact thing that happens in the rest of our body when our tissues get aggravated. We have a decreased amount of blood perfusion and we tend to have hyperactive neurons in some instances and other neurons that are hypoactive, basically leading to a big dysfunction in the body. If we can improve brain homeostasis, that is going to improve everything else in the body. So I think one slight misunderstanding that dry needlers have, and this may be, and I had this for a while too myself, it may be because if you've looked at ultrasounds, when a needle goes through living tissue, there's like a little fluid bubble or pressure bubble that gets pushed in front of the needle, right? When you see a needle hit a trigger point or a hypercontracted group of sarcomeres, either the whole trigger point dissolves or you hit it, part of it dissolves. If you hit it in another place, another part of it dissolves. That is the initial basis for the whole pistoning technique, which I do not agree with, and I don't think that performing the pistoning technique is a good idea, secondary to the nervous system response that we get. So when I perform dry needling or when I teach dry needling, everything that I think about is based off of what am I doing to the autonomic nervous system by placing this needle here in the body, right? So in general, to maximally depress sympathetic autonomic nervous system hyperactivity, we want to remove as much tissue pathology throughout the entire body as we can. Any tiny little millimeter of hypertonic or hypomobile tissue is going to be stimulating the sympathetic side of the autonomic nervous system. The more little bits of sympathetic stimulation we get, it could be temporal summation, spatial summation. If you get enough aggravation of the sympathetic nervous system to push it over its edge, it can't self-regulate and recover. So I think it's very, very easy to see the needle hitting pieces of tissue like trigger points, and you see the trigger point dissolve. And I think the logical initial thought is, oh, it's the needle that's hitting the trigger point and then the trigger point's dissolving. But that's not actually true. What's really happening is the needle is hitting the trigger point. That hypercontracted bundle of sarcomeres is sending a signal to the brain, and then the brain is sending a return signal that's telling the trigger point to relax. This is a reason why dead people don't have trigger points, you guys. Trigger points necessarily need electrical activity going through the body. When you're dead, electrical activity is not going through the body. So trigger points are secondary to sympathetic autonomic nervous system hyperactivity. If you think about dry needling as a brain treatment, you're going to have much more success of treating conditions because you're not going to allow yourself to get that tunnel vision focus where, for example, if somebody comes in with pelvic floor dysfunction, a question that I get a lot is, well, I treated the pelvic floor and it got slightly better, but the symptoms are still there and I don't know what to do. So my response to this typically is, well, unless there's a specific mechanism of injury to the pelvic floor, like you got kicked or you got hit with a baseball or something like that, the vast majority of impairments across the board are considered idiopathic, or there's no specific underlying mechanism. When this is the case, the specific underlying mechanism is the autonomic nervous system. So rather than just treating the pelvic floor for pelvic floor issues, I think a better way to think about it is the pelvic floor is a very parasympathetic dominant part of our body. It's the most parasympathetic dominant grouping of muscles that we have in our body. The 9 pelvic floor muscles are innervated by S2 to S4 to some degree or other, except for the obturator internus, which has some lumbar innervation, making our pelvic floor muscles the most parasympathetic dominant. The reason so many people have pelvic floor issues and jaw issues and upper cervical issues and cranial issues like headaches is because the pelvic floor and the upper cervical spine and jaw are parasympathetic dominant. Those areas are going to be the most negatively affected, or they're going to be the most inhibited secondary to sympathetic hyperactivity, because it's just the way that the nervous system works. The more the sympathetics go up, the more the parasympathetics get inhibited, and the most parasympathetically innervated structures in the body are going to be the most inhibited, right? This also includes complexes in the brain like the trigeminal cervical complex, the hypothalamic pituitary adrenal axis, the gut-brain axis, which is a connection between the enteric nervous system and the brain connected by the vagus nerve. Again, the vagus nerve is going to be highly inhibited secondary to sympathetic autonomic nervous system hyperactivity. So the recent study that came out about looking at the cranial suture lines and brain improvement showed both immediate improvements in blood perfusion and electrical activity in the brain and long-term improvements, and they're getting incredibly positive results for neurodegenerative diseases like Alzheimer's, MS, Parkinson's, which are all an underlying autonomic nervous system disease with the sympathetic side being hyperactive. So I think if practitioners can divert away from the common thinking of dry needling is a musculoskeletal trigger point treatment, which it is, but the reason that it works so well and the reason that it works so much better than other treatments is because it changes the brain far more, which allows the brain to then self-regulate the body. As far as the mechanical distortion that we're making with the needle, when you rotate the needle, we're certainly making a mechanical distortion of the tissue. We're causing mechanotransduction, right? We're utilizing that stress of biologic tissue to create nervous system changes. But that stress is very, very minimal. So when you needle somebody's calf, for example, and their hamstring range of motion or their toe touch test immediately gets 4 inches better, that is, you're not making 4 inches of mechanical change with the needle or with a bunch of needles. You're making that change by causing small mechanical distortions in the tissue, which are leading to large homeostatic brain changes. I think the underlying reason that needling accomplishes homeostasis in the autonomic nervous system so much better than other treatments is that needling is the only direct tissue treatment that we have for any tissue aside from skin in the body. So let's just say you're trying to treat the multifidus with your hands. You have to mush through the paraspinals, the lat, the trap, everything to get to the multifidus, and I really don't think you're hardly getting any stimulation on the multifidus itself. Compare mushing through 3 or 4 inches of tissue with directly touching said tissue with a needle. It's that direct contact of underlying tissue that stimulates a massive increase in brain reactivity to the treatment. And again, it just so happens that having a sharp, tiny little piece of metal poked into your tissues pushes our autonomic nervous system in our brain to areas of more homeostasis, which helps with all aspects of mental and physical health. So going back to the brain MRI thing, if you think of the little homunculus guy in the brain, right, in the motor cortex, you have a problem in your motor cortex, hypoxia, you can basically relatively well guess what's going to be going on in the body. The reverse holds true as well. If you have a problem with your left knee and somebody, you tore your MCL or you got hit with a ball or you got hit with a hockey puck or something, the corresponding area of the brain to the left knee is also going to be hypoxic and problematic. This holds true with mental health as well, right? So the body keeps a score. That's a very, very good book, by the way. So if you have a traumatic mental experience, some part of your body is going to get correlated with the part of your brain that's aggravated, and then both of those areas are going to be problematic in the future unless they're both treated concomitantly and together to remove both the brain pathology and the body pathology. You can't effectively do this by treating one or the other. They both need to be treated at the same time. So if we use dry needling as a brain treatment and we think about every single needle that we put in the body in a different location is going to be affecting a corresponding different location in the brain, and the overall result is improved blood flow and improved homeostasis in the brain. If you can induce improved brain homeostasis, that improves everything else in the body, and this is why you can see overweight, obese people, people with lots of underlying conditions that have had certain impairments for decades, and they get the proper type of dry needling combined with joint manipulation, and the problem completely disappears without changing anything else about their lifestyle. This is really, really incredible, and it shows you the power of the brain changes that dry needling can make, because the only way that you could take a chronically obese patient with low back pain for 30 years and completely resolve that in a handful of sessions, the only way that's possible is by making a huge change in the brain. And I see these results every single day when I'm treating my patients, every single weekend when I'm teaching my students. And the more and more I think about it, it really, really makes sense to me that if we think about dry needling as a brain treatment, we can achieve far more improvements in both mental and physical health than if we were utilizing dry needling and thinking about it primarily as a musculoskeletal treatment. Again, I'm not saying we're not treating the musculoskeletal system. We're treating the neuromusculoskeletal system all the time. But the primary way in which we're doing so is by placing needles in locations in the body that stimulate the proper locations of brain to go more homeostasis, improve blood flow, and to start functioning better. And then in return, the body and the organs and everything else starts functioning better, right? So if somebody's sympathetic nervous system is stuck in hyperactivity, what I think about is targeting the parasympathetic portion of the autonomic nervous system, because basically 100% of our patients are in sympathetic autonomic hyperactivity. So you stimulate the parasympathetics, that depresses the sympathetics, while at the same time removing as much tissue pathology throughout the body as we can. At some point, we're going to drop that patient's sympathetic autonomic nervous system back down to the level or to the range where it can self-regulate. I really think about it like hitting the reset on a computer or installing an antivirus program onto the computer. It's not that the brain and the body have forgotten how to function, right? They know how to function better than we ever will, I think. The problem is that they're being inhibited from using their awesome innate healing superpowers to heal themselves. What we need to do is think about removing the inhibition, stopping the autonomic nervous system from functioning properly. As far as physical therapy treatment goes, dry needling is by far the most powerful treatment. If you combine it with joint manipulation, it becomes even more powerful. And the primary reason that I think joint manipulation is so important is the sympathetic chain along our vertebral columns sits right on the anterior lateral portion of the vertebral columns. You cannot have spinal deviation without placing direct stress and strain on the sympathetic chain, which directly elevates sympathetic autonomic nervous system hyperactivity and inhibits our body from utilizing its healing powers. So the order that I like to go in is I like to needle first to loosen up the tissues, and then I like to manipulate as many joints as possible back to neutral, again with the underlying goal of pushing the autonomic nervous system towards as much homeostasis as possible, which involves depressing the sympathetics and elevating the parasympathetics as much as we can, so we can get that patient's ANS back into the range of self-regulation, and amazing things happen after this. I see such great improvements with mental health, concussions, handwriting, hiccups, incontinence, all sorts of chronic issues that are considered idiopathic by mainstream medicine. If you just target the autonomic nervous system specifically, and again, this is much, much more effective if your patients get on board with proper supplementation, proper diet, proper exercise, and just as a side note, to do proper supplementation, nowadays we have the ability to get genetic and epigenetic testing, which can give you the best background knowledge to make the most informed medical decisions for your personal biology as possible. A couple of companies that I really, really like for the genetic and epigenetic testing are Ways to Well. That's in Austin, Texas. Fountain Life is another really, really good one, and Inside Tracker is another good one. All those companies have genetic and epigenetic testing. Fountain Life is the best one. You can get a lifelong prescription for them. It's basically buying health insurance for life, utilizing the most advanced medical technology and testing that we have. And the great thing about those companies is their first line of action is not to give you prescription pills. It's to regulate what is causing your autonomic nervous system from deviating. So that would be adding in the base elements that our body needs to function, like supplementation, which is different for everybody, removing processed food from our diet, which is poison for human beings, and then treatments that have powerful autonomic nervous system homeostasis changing effects like dry needling. If you can combine as many autonomic nervous system treatments as we can, all with the goal of depressing sympathetics and elevating parasympathetics, the results that we can get in human beings are nothing less than astounding, right? The body knows how to heal itself. If we can remove the inhibition, keeping it from doing so, the possibilities are near endless. And this is one of the ways that stem cells and regenerative medicine, which I really like, are looking into things. So overall, if you think about dry needling as a brain treatment and you specifically target brain homeostasis with your needling, you will always be led to the area of primary complaint, because that's obvious that you need to treat that to reduce sympathetic autonomic nervous system hyperactivity, but it will keep you from going into tunnel vision mode, and it'll keep you thinking, okay, this person is getting slightly better, I've normalized tissue in this area, but their autonomic nervous system must not be down to a self-regulatory level yet. So what other areas of the body are pathologic? How can I treat those to reduce sympathetic hyperactivity while at the same time targeting the parasympathetics? We can achieve amazingly awesome results. So real briefly, as far as parasympathetic treatment in general, the vagus nerve distribution in the ears, the cranial suture lines. Remember, the cranial suture lines have active stem cells for life. We've just discovered that relatively recently, so that may be one of the reasons why needling the suture lines in the head seems to be so effective. Maybe it releases active stem cells into the brain. The jaw, the trigeminal nerve, the facial nerve, the glossopharyngeal nerve, the vagus nerve, the pelvic floor, which is parasympathetic dominant, all of those areas are very, very solid areas to treat to stimulate sympathetic depression, parasympathetic elevation, and autonomic nervous system homeostasis. If you can fix the brain will fix everything else, right? Thanks for listening, everybody. If you have any questions, let me know. Check us out at Intricate Art Spine and Body Solutions, intricateartseminars.com. We have 7 in-person classes, 4 dry needling, 3 manipulation classes. We have 2 fully online dry needling classes, and we also have a live online dry needling class. So check us out. Let me know if you have any questions. Thanks.